I'm pleased to be able to share with you important information about breast cancer, a disease that affects millions of individuals and families around the world. Breast cancer is not just a disease, it is a major public health issue that affects the lives of many people. Breast cancer is caused by the uncontrolled growth of breast cells, and while it primarily affects women, men can also develop the disease. Understanding breast cancer is essential for early detection, effective treatments, and ultimately improved survival. I will explore the structure of the breast, the various types of breast cancer, its history, risk factors, symptoms, and diagnostics and treatment aspects. Let's start with anatomy of the breast to better understand how breast cancer develops. The breast is a complex organ composed of various tissues, each serving specific functions. Here's detailed overview of its structure. First is fat tissue. Adipose tissues make up a significant portion of the breast, contributing to its size and shape. The amount of fat varies among individuals. Lobules. The breast consists 15 to 20 lobules, which are the milk production glands. Each lobule consists of smaller units called acini. During lactation, these glands produce milk. Milk from the lobules flows through ducts, which are tube-like structures that cover toward the nipple. The duct transports milk to the nipple during breastfeeding. Nipple, the producing structure at the center of the breast through which milk is delivered during breastfeeding. The nipple contains multiple openings for the milk ducts. Areola, the pigmented area surrounding the nipple. It contains small glands that secrete oil to lubricate the nipple during breastfeeding. The breast has a rich blood supply and a network of vessels that help in the immune response and can be pathways for cancer to breast. Breast cancer is not a single disease. It encompasses various types, each with distinct characteristics and behaviors. The main types include ductal carcinoma Institute, a non-invasive center where abnormal cells are found in the lining of the ducts. While not life-threatening, it can increase the risk of developing invasive breast cancer in the future. IDC, this is the most common type of breast cancer, accounting for about 7 to 18 of cases. It begins in the milk ducts and invasive surrounding breast tissue. IRC, this type starts in the lobules and can also spread to nearby tissues. It is second most common invasive breast cancer. HER2 positive breast cancer, characterized by overexpression of the HER2 portion. This type can grow more aggressively but is treatable with targeted therapies. Each type of breast cancer requires a tailored approach to treatment, emphasizing the importance of correct diagnosis. Breast cancer is the most common cancer among women worldwide. According to organizations such as the American Cancer Society and the World Health Organization, about 1 in 8 women will be diagnosed with breast cancer in her lifetime. About 1 in 1,000 men are diagnosed with breast cancer. Signs of the breast cancer: skin changes such as swelling, redness, or other noticeable difference in one or both breasts, enlargement or change in shape of the breasts, changes in the appearance of one or more nipples, discharge from the nipple other than milk, pain in any part of the breast, lumps of or nodules felt on or in the breasts. Ductal carcinoma Institute of the breast does not cause any symptoms. In rare cases, women may feel a lump in her breast or discharge from her nipple. However, most ductal carcinoma Institute is detected by mammogram. lobular cancer symptoms of the breast does not cause symptoms and cannot be detected by mammogram. It is usually found when a doctor performs a breast biopsy for their reasons, such as examining an unrelated breast lump. With LCIS, breast cells appear abnormal under a microscope. The historical of breast cancer. Breast cancer has been known to mankind since ancient times. It has been mentioned in almost every period of recorded history. Because of the visible symptoms, especially at later stage, the lumps that progress to tumor has been recorded by physical from early times. This is more so because, unlike other internal cancers, breast lumps tend to manifest themselves as visible tumors. Earlier, however, it was a matter of tobacco and impression that made detection and diagnosis were rare. The mention of breast cancer in literature beyond medical journals and works were rare involves of more women and activity bearing out the disease into the open in a recent phenomenon that is surrounding 3 or 4 decades old. In 1990s, the symbol for breast cancer, the Peking ribbon, brought out a revolution against this cancer. In Asia, was the first known disease more than 3,500 years ago. The condition was described fairly accurately in both Smith and George Abers. One of the descriptions referred to blogging tumors of the breast that has no cure. In 416 BC, the father of Western medicine, Hippocrates, described breast cancer as a humoral disease. He postulated that the body consists of 4 humors: blood, yellow bile, phlegm, and black bile. He suggested that cancer was caused by the excess of black bile. In appearances of the breast cancer to black, hard tumors are seen that breast force, if filled untreated, to yield a black fluid. He named the cancer cacurrence, a Greek word for crab, because the tumors seem to have tentacles like the legs of the crab. Therefore, in AD 200, Galen described the cancer as well. He also suggested excessive black bile, but unlike Hippocrates, he postulated that some tumors were more dangerous than others. During this time of history, breast cancer was a disease that affected the whole body, and thus surgery was not considered. Until the 17th century, Galen series breast cancer was delivered. It was in 1757, while Henri Ledrain, a leading French physician, suggests that surgery removing of the tumor could help to treat breast cancer as long as infected nodes of the apex were removed. In 1895, Scottish surgeon George Bateson discovered that removing the ovaries from one of his patients, Sharik, her breast tumor, as he catch on, many surgeons began removing the both ovaries and performing a radiomastectomy for breast cancer. This reduction of the tumor after removing of the ovaries was due to the fact that estrogen from ovaries helped in growth of the tumor, and their removing helped reduce the size of the tumor. What comes next was that those women without ovaries, estrogen was produced by the adrenal glands. In 1952, Caloris began removing a woman's adrenal gland in an effort to strip to the tumor of estrogen. In 1976, Fisher published resulting using simple breast conserving surgery by radiation. He notes that this was just as effective as radiomastectomy. 25 less than 10% of breast cancer inflicted women has a mastectomy. In 1995, less than 10% of breast cancer inflicted women had a mastectomy. This time also saw the development of novel therapies of breast cancer, including hormone treatments, surgeries, and biological therapies. Mammography was also developed for early detection of the cancers. Scientists then isolated the genes that cause breast cancer, BRCA1 and BRCA2. The risk factors for breast cancer. Non-modified risk factors. Women are significantly more likely to develop breast cancer than men. The risk increases with age, with most diagnoses occurring in women over 15. Having close relatives, like a mother, sister, daughter with breast cancer, can increase the risk, particularly if multiple family members are affected. Inherent mutations in genes such as BRCA1 and BRCA2 significantly elevate the risk of breast and cancers. Center ethnic groups have different risk levels. For example, Caucasian women have a higher incidence than African American women, though African American women may experience more aggressive forms of the disease. Modified risk factors like early menstruation before age 12 or later after age 55 contribute to prolonged exposure to estrogen. Women who have never had a child or who have the first child after age 30 may have a higher risk. Being overweight or obese, especially increase the risk due to higher estrogen levels produced by fat tissue. This is evidence linking smoking to an increased risk of breast cancer, although the association is not as strong as with other cancers. Long-term use of compound HRT for menopausal symptoms have been linked to the increased risk of breast cancer. It's best to perform a self-exam once a month, a few days after your period ends. This is when your breasts are less likely to swell or tender. First is visual inspection. Stand in front of a mirror with your arms at your side. Look for any changes in the shape, size, or contour of your breast. Rest your arms above your head and looking for the same changes. Checking for changes of skin, such as dumpling, puckering, or unusual disclosure. Inspect your nipples for any changes in position, discharge, or unusual appearances. Second is physical examination. While standing or lying down, use pad of your fingers, not your fingertips, to feel for lumps or abnormalities. Start with the outer side and working inward. Use circular motion to cover the entire breast. Use 3 levels of pressure: light pressure to feel tissue closest to the skin, medium pressure to feel deeper tissues, firm pressure to feel the tissue close to the chest wall. Check the entire breast area, including the upper outer quadrant, the upper inner quadrant, the lower outer quadrant, the lower inner quadrant, and the area under the nipple. Don't forget to examine the area under your armpit for any lumps or swelling. Diagnostic mammogram. Definition: a specialized X-ray used to investigate symptoms like lumps, pin, or follow-up abnormal screen mammograms. It can detect masses or other abnormalities. Breast tissue is compressed while multiple X-ray images are taken. The exam takes about 30 minutes. Best for initial evaluation of breast cancer, but less effective in dense breast tissue. Second is breast ultrasound. Uses sound waves to produce images of the breast. It can distinguish between solid masses and fluid fields sizes. A gel is applied in the handheld device. Is moved over the breast. It takes 15 to 30 minutes. Best for examining lumps or areas flagged by mammograms. Breast MRI use images and radio waves to create highly detailed images, often with contrast dye. It can evaluate the extent of knowing cancer, screens high-risk individuals, or assesses treatment effectiveness. You can lie face down and the exam takes 30 to 60 minutes. Best for high-risk patients and detailed evaluation, but can be costly and lead to false positions. Prevention and treatments versus surgery. Mastectomy, removing of one or both breasts. This can be total removal of the entire breast or partial removal of specific sections. Second is radiotherapy, the use of high energy rays like X-rays to kill or shell cancer cell. External beam radiation delivered from machine outside of the body. Chemotherapy, a system treatment that uses drugs to kill rapidly dividing cancer cells. Administration can be given before surgery to share tumors or after surgery to reduce recurrence risk. Hormone therapy treatment for hormone receptor positive breast cancer that rely on hormones like estrogen and progesterone to grow. How do you know 1 to 3 hours of exercise a week over women's reproductive lifetime may bring about 20 to 30 reduction in the risk of breast cancer, and 4 more hours of exercise a week can reduce the risk by almost 16%. Thank you for watching, and this is a reference.